Good afternoon, ladies and gentlemen, and welcome to the Water Contamination and Waterborne Disease webinar. At this time, all participants are in a listen-only mode and will remain so for the duration of the call. Please note that this conference is being recorded. I will now turn the call over to Dr. McClellan. You may begin.
Well, thank you for joining us for this Water Contamination and Waterborne Disease webinar. I think you're going to enjoy the session quite a bit. We're starting out with 75 minutes of lecture, and we'll end the call with 10 to 15 minutes for questions at the end. There'll be 1.5 hours of CME and MOC credit available for this program. You should have received a verification form with today's instructions, or you can follow the link that was in the instructions. Remember, no certificates will be sent to you, but your transcript of this and other ACOEM educational programs can be viewed and printed from the ACOEM website. Members and non-members can both view their transcript directly from the website. Throughout the program, we'll be accepting questions electronically. On the screen, you can see how to open the question box in order to submit your questions. This will also be in the PDF file of your handouts that you received with the instructions. We will address questions as time permits and suggest that you submit your questions as early as possible for consideration. If you need technical assistance or talk to a speaker, you can talk to a speaker at any time during the webinar. Please dial *0. We have no faculty disclosures to make for this program. Now, it is my sincere pleasure to introduce Patricia L. Meinhardt, MD, MPH, MA, to you. She is an Occupational and Environmental Medicine specialist with expertise in the medical management of water-related disease resulting from natural, man-made, and intentional contamination of drinking water and recreational water. She's provided technical assistance to state and federal public health and disaster response agencies, and has presented disaster preparedness and waterborne disease recognition training to 18,500 medical and public health practitioners, emergency response, and disaster management professionals, and law enforcement and public infrastructure specialists over the past 5 years. She's also authored 5 chapters on water quality, waterborne disease, and disaster medicine. And she's developed a fantastic online medical reference guide addressing waterborne disease, water terrorism, and medical preparedness that's available at waterhealthconnection.org. It's received more than 9.8 million hits for information from more than 350,000 users in 89 countries across the world. Dr. Meinhardt, we look forward to your presentation.
Thank you for that kind introduction, Dr. McClellan, and welcome everyone to our ACOEM webinar entitled Water Contamination and Waterborne Disease, Are Your Patients at Risk? Now, waterborne disease and the health effects of water pollution and contamination is a very big subject area, and we have a limited amount of time today to discuss this important environmental medicine topic. So during the first 70 or 75 minutes, I'm going to be providing you a general overview of what I consider to be some of the most important background information that you'll need to understand the challenges of recognizing and managing waterborne disease and the health effects of water contamination in your patients. Several of the areas that we are going to cover today require us to consider how we use water in our everyday lives and how those water management practices may impact the health of our patients, particularly those who are most vulnerable to water-related disease. We're going to follow my general overview with a question and answer discussion that I hope will be informative for all of you today here in attendance. I've included reference material at the end of this presentation to provide you with some take-home references for future use. Now, all of you should have a copy of the PowerPoint slides as we move through this presentation. They're very content-dense, and they're downloadable at the webinar website. One thing I do want to note, I note that our audience today is composed of both clinicians and non-clinicians. My comments today will be focused on material that I believe healthcare practitioners will find useful, but I also hope that everyone else will find this information of use as well. So with that brief introduction, let's begin. Let's quickly review the continuing medical education learning objectives for the physicians who are credit. And this will also really act as our presentation tools for this educational. At the end of this presentation, you should be able to first recognize the medical, public health, and economic consequences of water contamination for a community that result either from natural or man-made disasters. Second, you should be able to understand clearly the clinical challenges that complicate accurate diagnosis and management of waterborne disease and the health effects of both acute and chronic water pollutants. Third, I'd like to review the 5 critical sources of contamination that result in water-related disease that I believe represent the greatest public health threat to our patients, especially to susceptible populations most at risk for serious morbidity and mortality from water-contaminated exposure. You should also be able to identify the most recent trends in water-related, in waterborne illness and water-related deaths, both from drinking water exposure and recreational water exposure in the U.S. We're going to review the most recent information released by the CDC in September of this year. We will also be discussing the importance of medical practitioners as sources of information and education regarding water quality and protection, both for your patients and for your community. And I'll also be reviewing the reference guide, the Water Health Connection website briefly, which is a free physician reference guide that I hope will be useful to you. And we'll be discussing the guide a little bit at the end of the webinar. So, understanding waterborne disease and the health effects of water contamination, I believe, is really vital to our nation's public health due to the fact that access to safe drinking water, as we all know, is a cornerstone of public health. And it's important for us to remember that modernized sanitation methods and really access to potable water have increased the lifespan and improved the general health of Americans more than any other advancement in the field of medicine. So let's note the obvious. So we clearly understand the vital need for water for basic human survival. This need was certainly underscored during the aftermath of Hurricane Katrina and really several other natural disasters that have occurred in the U.S. this summer. We also understand that contamination of water is a serious public health threat for many reasons. First, safe drinking water is obviously vital for human survival to prevent dehydration. Water is essential for basic hygiene and modern sanitation methods, including wastewater treatment. Always important for us to remember that water use is key to really every sector of our complex industrialized economy as an essential component for the production of many goods and services. And finally, uncontaminated water is crucial to food production and livestock health. Contamination of a community's water supply, whether it be from biological, chemical, or radiologic compounds, can result from several factors. First, natural disasters such as hurricanes, earthquakes, and floods. We have many examples of this type of water contamination with the severe flooding that occurred in the Midwest this summer. And of course, none of us are ever going to never forget the water disaster named Hurricane Katrina. Second, there's the issue of man-made accidents, such as chemical or radiologic releases in source water. We're going to briefly discuss an example of this type of water contamination later in the presentation with the 400,000-gallon oil spill in the Mississippi River that occurred near New Orleans this past July. And third, intentional contamination or acts of water terrorism. Water really may act as a very effective delivery system for weapons of mass destruction agents, since many of these compounds are water-soluble. And intentional contamination of U.S. water supplies may be part of an organized effort by terrorists to damage our nation's critical infrastructure. You all know that even short-term disruption of water service can significantly impact a community. Whether it's man-made or natural contamination of a municipal water supply, the consequences are very significant, whether it's medical, public health, or economic consequences. And really, to illustrate this point, I'm going to review with you 3 previous water contamination events that have occurred in the U.S. and Canada that resulted in contamination of municipal drinking water systems in order to illustrate the serious impact of water contamination in the community and really the devastating consequences on public health. So let's review some of these serious health consequences. I'm sure many of you remember the massive outbreak of waterborne cryptosporidiosis in Milwaukee, Wisconsin that occurred in 1993. This is an example of how contaminated water distributed through a municipal water system can really significantly impact a community from medical, public health, and economic perspective. Remember, during the outbreak, an estimated 403,000 Milwaukee residents developed diarrhea, which reflected an attack rate of 52% of the population that was served by this contaminated municipal water system. Remember also that 4,000 Milwaukee residents were hospitalized during the waterborne outbreak, with cryptosporidiosis listed as the underlying or contributory cause of death in at least 54 residents following the outbreak, and we believe that number is now as high as 100. Also remember, it's been estimated that 725,000 productive days were lost as a result of the water contamination event, at a cost in excess of $54 million in lost work time or additional expenses to the residents and the local authorities in Milwaukee. And remember, those are in 1993 dollars. Here's another example from a small rural community, which are also just as highly at risk for water contamination events as large communities. In 2000, the much smaller community of 5,700 residents in Walkerton, Ontario, their municipal water supply was contaminated with E. coli 015787. And that resulted in 2,300 symptomatic residents, or 40% of the population ill, and 7 deaths were attributed to the waterborne disease outbreak, many of them in children. More than $11 million was required to reconstruct the community municipal water system and install temporary filtration after the contamination event. $70 million was attributed to a class action settlement resulting from the contamination event. The current cost of the total outbreak and municipal water contamination event in Walkerton now has reached $155 million. Again, those are in $2,000, and this represents remediation in a community of only 5,700 residents. I also want to note the sign that I have in this slide in the right-hand corner. E. coli, please go away. This waterborne outbreak really devastated this small rural community, so there are many social consequences to an event like this as well. So imagine the magnitude of the medical, public health, and economic consequences of a water contamination event, let's say in a major region of the U.S. involving many cities and states. Unfortunately, we have a very fresh example of this type of regional disaster called Hurricane Katrina. The level of devastation from Hurricane Katrina on water delivery, wastewater treatment, and source water networks is really unparalleled in U.S. history. It's not surprising that the resulting public health and economic consequences of this water contamination event are really both disturbing and sobering. Really, the entire water delivery, wastewater system, and source water network in the Gulf are in serious need of being rebuilt and remediated. So let's just review a few of the damage estimates to the water delivery and wastewater treatment systems, not including the source water cleanup from the Gulf from this massive hurricane. 1,236 public water systems were damaged or destroyed just in Louisiana and Mississippi alone. 200 sewage treatment plants were affected in Louisiana, Mississippi, and Alabama. There was fecal and chemical contamination of hundreds of miles of water distribution pipes and thousands of gallons of source water resulting from this single storm. And remember, thousands of private wells were at risk of contamination in rural Gulf regions affected by the storm. How do we comprehend the true cost of rebuilding the water service infrastructure in the Gulf region? If we attempt to address the cost estimates of repairing just the public water supply systems damaged by Katrina, we have the following. In the hardest hit high-impact counties of just Louisiana and Mississippi, the estimated cost of repairing just the water supply site infrastructure is $2.2 billion. These examples really illustrate the potential power of water contamination events and their impacts on our patients and our communities. In addition, the public health challenge of diagnosing and managing waterborne disease, whether it's from a natural or accidental contamination of water, is also very daunting. Because as you're all well aware, contamination of water either by chemical agents or infectious pathogens may affect the health of millions of Americans and may lead to significant morbidity and mortality, especially in vulnerable populations at increased risk of disease. In addition, there's another issue and a problem. Misdiagnosis and underdiagnosis of waterborne disease and the health effects of water pollution is quite common as a result of the fact that, first of all, water consumers, our patients, are frequently unaware of potential exposure to waterborne contaminants, and they often seek medical care from healthcare providers who are frequently unfamiliar with the health effects associated with waterborne pathogens and exposure to chemical or radiologic contaminants. This photo in the slide in the right-hand corner is a photo of illegal and covert dumping of toxic waste in a community water source. So clearly, neither patient nor healthcare provider would have been aware of this potential waterborne exposure. Now, inadequate diagnosis, misdiagnosis, and underreporting of cases of water-related disease by healthcare practitioners can have serious consequences at not only the state and local level, but at the federal level as well. Inadequate diagnosis and lack of conscientious case reporting, first of all, can confound waterborne disease surveillance programs. It really can limit implementation of water treatment and protection strategies and procedures by water utilities. And it can certainly confuse risk assessment and resource allocation efforts at the local, state, and federal level. Accurately diagnosing water-related disease is really a challenge for all of us as healthcare providers, since the majority of us really receive little or no training, no formalized training during our medical education or subsequently in years in active clinical practice in either the recognition, evaluation, or management of waterborne disease, or specifically the health effects of water pollution. Here lies the problem. Although water quality detection methods for recognizing contamination of a watershed or water treatment facility are improving, that is, water quality monitoring completed by water utilities for water contaminant agents continue to improve every year. Still, many times the most likely initial indication that a water contamination event has occurred in a community will be a change in disease trends or illness patterns. Now, remember our example of Walkerton, Ontario, Milwaukee, Wisconsin, those outbreaks. Both of those water contamination events became apparent when community members became ill in record numbers and presented to their healthcare providers and sought care. And secondly, contamination can also present as a community-wide waterborne disease outbreak or a cluster of water-related cases of chemical or radiologic toxicity in the general population. And there are certainly many examples of chemical contamination of groundwater that have been discovered after the fact as a source of disease in a community. So, early recognition, accurate diagnosis, and conscientious reporting by community healthcare providers of suspected waterborne disease cases is really essential to protect the public's health and our patients' health. And local community healthcare providers are likely to provide really the first warning to health authorities of waterborne disease outbreaks or possibly the health effects of chemical or radiologic contamination. It's important to note again, during that Milwaukee cryptosporidiosis outbreak, it was an astute family medicine physician who noticed an unusually high rate of diarrhea in his nursing home patients, which was the initial warning sign of the waterborne disease outbreak. So local healthcare practitioners are really critical players in addressing waterborne disease and water contamination in their community. Now, believe me, I am not diminishing the challenge that we face. Even in the best of circumstances, the diagnosis of water-related disease is a diagnostic challenge for most healthcare providers. So let's review a few of these diagnostic challenges that we face when we attempt to address water-related disease in our patients. I think it's important to do this because it does help us understand the clinical challenges that complicate accurate diagnosis and management of both waterborne disease and the health effects of acute and chronic exposure to water pollutants. Diagnostic challenge 1. Prompt identification of water-related disease by healthcare providers may be compounded by difficulties in early diagnosis. First, many of the biological, chemical, and radiologic compounds found in water are not detectable by human senses, since they're colorless, odorless, and tasteless. Second, both food and water supplies may be contaminated without any obvious change in appearance or physical characteristics that are going to be noticeable to your patients or water consumers. So third, exposed patients may be completely unaware of their water contaminant exposure from either acute exposure or chronic long-term exposure to contaminants in their water. Diagnostic challenge 2. The majority of biological, chemical, and radiologic agents that may contaminate water supplies are not unique to water or the aquatic environment. For example, many waterborne agents may be distributed through multiple routes of exposure in addition to the waterborne routes, such as food or secondary transmission, zoonotic or animal contact, soil or air. All of these may be potential routes of exposure. And healthcare providers are going to be challenged then to obtain accurate exposure histories from symptomatic patients who may have been exposed to waterborne agents through multiple exposure pathways, including the waterborne route of exposure. So really obtaining an accurate exposure history for symptomatic patients may be difficult, but is clearly an essential part of evaluating these patients. Diagnostic challenge 3. Contamination of water with biological, chemical, or radiologic agents may lead to disease not only from exposure to drinking water, but other exposure scenarios as well, including ingestion and aspiration of water, dermal absorption through bathing and recreational activities, inoculation of skin lesions from direct contact with contaminated water, consumption of food directly contaminated by water during food preparation, and consumption of food indirectly contaminated by water via the food chain or agricultural practices. Diagnostic challenge 4. In addition, waterborne disease may be distributed through many common venues that patients and their healthcare providers may not suspect. Public drinking water may represent only one source of waterborne exposure, with contamination of recreational waters, swimming pools, or even bottled water also a possible contaminant source. This picture depicts a water park where there is clearly potential for major water exposure to a large population of users in a short period of time. We're going to review some examples of these type of waterborne exposures later in the presentation. Diagnostic challenge 5. Let's discuss a few specific challenges that are related to biological pathogens. Specific challenges for healthcare providers in diagnosing disease from biological pathogens that may contaminate water. First, many of the signs and symptoms of water-related disease from infectious pathogens are non-specific and mimic more common medical disorders. The presenting symptom of diarrhea couldn't be more non-specific, and that's frequently what you receive. Second, co-infection with multiple waterborne pathogens are really common scenarios if water supplies are contaminated. So your patient may present with an exposure to waterborne Cryptosporidium, Giardia, Campylobacter, and E. coli all at the same time, which can present a very confusing clinical picture. Diagnostic challenge 6. Many of the water-related diseases and syndromes associated with water contamination events, let's say from a natural disaster like Katrina, may be unusual presentations of disease not commonly seen in the community. So many local healthcare providers are going to be quite unfamiliar with these diseases since they're a departure from the disorders that they frequently see in their typical daily practice. So after Hurricane Katrina, the CDC posted very valuable information for healthcare providers detailing the signs and symptoms of hurricane-related waterborne pathogens that included Vibrio vinificus, Vibrio hemolyticus, leptospirosis, trench foot, Legionella, waterborne E. coli. This photo depicts the type of situation that you would be facing. This is the search and rescue team rescuing a New Orleans resident 1 week after Hurricane Katrina. So this gentleman had fallen into the water after being rescued several times. So the type of water rescue is messy with multiple exposure routes to many water contaminants at the same time. Let's discuss a few of the challenges related to chemical contamination of water, which is our diagnostic challenge number 6. Exposure to chemical agents in water really creates specific challenges for healthcare providers that differ quite significantly from the medical sequelae created by biological agents. First, it's important to remember the array of potential chemical agents in water is expansive, and it includes many commonly used industrial and agricultural compounds. And there are approximately 84,000 chemicals in commercial use in the United States, and they have a very broad range of toxicity, symptoms profile, and health effects. So this photo depicts multiple chemical releases in just a small business industrial area after a summer flood. Now, the spectrum of medical sequelae from chemical exposure ranges from mild symptoms to very severe tissue damage, depending, again, upon the toxicologic profile of the waterborne chemical agent. So let's review a few examples from the contaminated water resulting from Hurricane Katrina. This photo is quite interesting. It depicts the household hazardous waste and olefin containers that were collected from the floodwaters in just one of the parishes in the Gulf region. You can imagine the diversity and complexity of the chemical release in the Gulf waters just from household chemicals. It's really quite overwhelming. There's also the major challenge of chemical release from industry. The preliminary estimates indicated that contaminated water in New Orleans contained 6.7 million gallons of petroleum from damaged refineries and chemical contamination from more than 390 oil spills. And this photo depicts the contaminated water surrounding the large tank farms in the New Orleans industrial park. Also, 1 to 2 million gallons of gasoline just from damaged gas stations and chemical releases from more than 300,000 flooded automobiles. Again, remember that water can be an excellent solvent and really can act as an effective carrier of multiple chemical agents during hurricanes, flood, or groundwater contamination. And this photo clearly depicts severely contaminated water from a New Orleans neighborhood prior to cleanup. Also, we have the impact of ongoing industry in an area and past issues. The compounds in New Orleans from 31 designated hazardous waste sites in the affected region were also part of the water contamination in the area. And there were 446 industrial facilities in the flood zone that were using hazardous compounds, including lead, mercury, hexavalent chromium, arsenic, benzene, and pesticides. And again, this photo depicts an aerial shot of a flooded neighborhood in New Orleans and homes and businesses with, again, a petroleum slick and other contaminants in the flood water. Diagnostic challenge 8. To complicate matters even worse, physicians may be faced with this dilemma. Co-infections with waterborne pathogens coupled with multiple chemical agent exposure in contaminated water may result in both acute and delayed symptoms, complicating accurate and timely diagnosis. So this photo on the slide illustrates the type of waterborne exposure that some of the residents in the hurricane region experienced. So evaluating this resident for both short and long-term health effects of waterborne exposure to both chemical and biological waterborne agents really clearly is a serious diagnostic and management challenge. Diagnostic challenge 9. It's important to remember that biological, chemical, and radiologic contamination of water in a community may have both short-term and long-term consequences for your patient. Healthcare providers may need to address both short and long-term medical sequelae in their initial evaluation, and they may also need to be thinking about ongoing medical management of their exposed patients. In addition, long-term public health consequences of water contamination with biological, chemical, or radiologic agents may result in delayed, prolonged, and in some cases environmentally mediated health effects. Now, one prime example of this medical challenge is the medical monitoring required to follow a patient who may be at risk for a cancerous outcome from a chemical exposure from, let's say, contaminated well water, and you'll need to follow that patient for many, many years. In some cases, those endpoints may not present for decades after exposure to the waterborne contaminant. Diagnostic challenge 10. There are specific diagnostic and management challenges that arise when dealing with susceptible populations in waterborne disease and water contamination. Now, this is one of the most important points that I'd like to make today, and is really critical for all of you to embrace in your practices. Water-related disease may present as benign symptoms or self-limited disease in a healthy patient population, while the same exact water contamination exposure in a vulnerable patient population may result in significant morbidity and mortality. The impact of water contamination events depends upon the type of population exposed and their level of host vulnerability. And individual vulnerability to waterborne agents may vary, and differences in host susceptibility factors may indeed complicate recognition of disease in your patient. Unfortunately, missing this diagnosis is a problem, and these sensitive populations will experience the most drastic health outcomes from really any biological, chemical, or radiologic contamination of water supplies. There are significant challenges to managing and preventing water-related disease in vulnerable populations for several reasons. 20% of the U.S. population is now considered to be at increased risk for the lower levels of exposure to waterborne microbial or chemical contaminants. And part of that reason is the percentage is expected to escalate as lifespans increase and as immunocompromised individuals are surviving longer. Several other factors play a role in determining an individual's susceptibility to a water-related disease. Our susceptibility changes with age. We move from highly susceptible developing fetuses to low-risk status as healthy adults to an increased susceptibility as elderly patients with chronic disease. And it's important to remember that an individual patient's susceptibility to waterborne disease does not remain constant or fixed in time. Intermittent illnesses and accidental trauma, like a car accident, may shift the susceptibility status of even a healthy, low-risk individual to one of a susceptible patient. Now, other biological factors also play an important role in determining an individual's susceptibility to water-related disease. Factors such as the higher ratio of skin surface to body mass in children results in a proportionally greater body burden of water contaminant exposure than in adults. And factors such as pregnancy may lead to increased susceptibility. For example, the case fatality ratio from an infection of hepatitis B for pregnant women during a waterborne outbreak is 10 times greater than that for the general population. Let's quickly review the list of selected susceptible populations at increased risk for water-related disease. These populations include neonates, infants, and children. Any of your patients with pre-existing clinical disorders or chronic diseases resulting in impairment of the renal, hepatic, or immunologic system. Geriatric patients, certainly including nursing home residents. Immunocompromised or suppressed individuals, those with HIV/AIDS. Patients undergoing immunosuppressive therapy, for example, for organ transplantation, patients being treated with any of the chemotherapeutic drugs, and certainly pregnant women and developing fetuses. So these are the patients in your practices who really demand conscientious attention with respect to water-related disease. Now, in order to effectively diagnose and manage a patient with water-related disease, it's critical that we all have a basic understanding of the types of water contamination or pollution that may present health risks for our patients, again, particularly for members of susceptible populations, and that there are multiple reservoirs of infection and various modes of transmission that often complicate a clinician's assessment of a patient with a possible water-related disease. There are 5 critical sources of water contamination that we must become familiar with in order to effectively understand water-related disease and better manage our patients. So in the U.S., and I'm restricting my comments today to the U.S., there are these 5 sources include drinking water contamination, recreational water pollution, special uses water contamination, and we'll discuss that in a few minutes, man-made disasters and intentional water contamination, and certainly natural disasters that result in water contamination. Let's first discuss drinking water contamination. Two large types of contamination. The first being microbial contamination. Second being chemical contamination of drinking water supplies. Now, microbial contamination of drinking water frequently results from animal or human sewage contamination of, let's say, source water. It may not have been adequately treated by available disinfection or filtration procedures. So we have the challenge of water safety from microbial contamination that includes infectious pathogens such as Cryptosporidium, which can be resistant to routine water treatment technologies, a big challenge. Secondly, chemical contamination of drinking water may result from multiple sources ranging from agricultural runoff to leakage from underground storage tanks to industrial discharges and chemical spills. Chemical contamination of drinking water may be generated by naturally occurring phenomenon as well. Arsenic, lead, and copper erosion of natural deposits is also a significant issue, particularly in the West in the United States. Or human activities, such as nitrate contamination from fertilizer use or discharge of chemical solvents from industrial processes. I'm going to review a few quick examples of each of these types of water contamination. Remember the example of contamination of the rural water supply of Walkerton that I discussed with you earlier, the toxic E. coli outbreak in 2000. Remember, Walkerton was a rural community of 5,700, and that municipal water supply was contaminated with E. coli 015787, with 2,300 symptomatic residents and 7 deaths attributed to the waterborne disease outbreak. Again, many of them in children and other susceptible populations. I'm presenting a slide that basically is a snapshot of the reason behind the outbreak. The Walkerton outbreak resulted from microbial contamination of drinking water from animal manure contamination of the town's well water. And I think you can see from this slide, if you look in the very center, the location of well number 5. And the close proximity of farm fields in the left upper hand corner where they applied cattle manure in the spring. Now, the outbreak started after torrential rains washed E. coli bacteria from that cattle manure spread in April in the fields, and it contaminated the shallow town well number 5. You can see how close that is. So after the torrential rains, 5 days later, residents started complaining of bloody diarrhea, vomiting, cramps, and fever to their healthcare providers, which were symptoms of E. coli exposure. 7 days later, hundreds in the tiny community had fallen ill. 11 days later, 3 children had died and more than 150 residents were hospitalized, with another 500 complaining of symptoms to their healthcare providers. 12 days later, at least 4 children were in critical condition with hemolytic uremic syndrome. 18 days later, 7 residents had died and 40% of the town's population was ill. So microbial contamination of drinking water can be swift and deadly. Here's an example of the consequences of drinking water contamination with chemicals. This report is titled Living in Fear of One's Own Water Supply. This incident describes a property owner who had been told that the test wells on her neighbor's property and only a few feet from her land had been found to contain hexavalent chromium from a plume from Pacific Gas and Electric plant nearby. This is the same community depicted in the Aaron Brockovich film that I'm sure many of you saw, where industrial groundwater contamination with hexavalent chromium led to one of the largest water contamination awards in history. That award compensated all of the named plaintiffs and well owners, and it was in the amount of $338 million. So this is just one example of chemical contamination of drinking water from groundwater contamination in the U.S. We have major issues in the United States with this particular type of water contamination. Examples would be MTBE, the gas additive, which has contaminated water supplies in several communities. Many communities have filed MTBE lawsuits. I know that there are approximately, I believe, about 157 pending lawsuits in 17 states claiming contamination of groundwater from just this one chemical, MTBE. Another critical source of waterborne disease and water contamination for you to be familiar with is recreational water exposure or pollution. According to a report from the Environmental Protection Agency, unfortunately, as many as 40% of U.S. beaches, rivers, estuaries, and lakes may be polluted with microbial or chemical contaminants. And exposure to contaminated water really has resulted in a series of recreational water outbreaks arising from exposure in such venues as swimming and wading pools, lakes and ponds, rivers and canals, decorative fountains, hot tubs, and springs. During the 2005-2006 reporting period, 78 recreational water outbreaks were reported with more than 4,000 illnesses and unfortunately 5 deaths. This is the largest number of recreational water outbreaks to occur in the United States since reporting began in 1978. So it's important to know recreational water exposure to infectious pathogens, and particularly some of the parasites, bacteria, and waterborne viruses, really have a potential to cause serious morbidity and mortality, again, in the susceptible populations that we discussed, particularly children. This is just another quick example of what the public sees all the time. This is an example from MSNBC. American beaches, just how clean is the water? This is from July 2006, and the report reads that a gentleman had, he said, nearly died after a day of surfing on California's Seal Beach. He had to be treated with antibiotics, was in the hospital for a week, and he believes that he had a very close call here with death. And unfortunately, in this particular situation, the sewage spill had not been reported, so he was completely unaware that he was being exposed to the pathogens while he was surfing. This is another example of a large recreational water outbreak in upstate New York here where I practice. This occurred in August of 2005, and it's really quite remarkable for the impact and the spread. The State Health Department had to issue several updates to those of us that were healthcare practitioners. The number of reported illnesses related to the water park exposure rose to over 2,000, and what was interesting was that those cases were reported in 24 counties. after a weekend. This was a result of one weekend of recreational water exposure on a very hot summer day in upstate New York at a water park. So 2,000 cases, 24 counties in a short period of time, quite remarkable. Let's review another important source of contamination in the U.S., special uses water. And this water is used for purposes other than drinking and recreation. So one use of water that's essential, our use of water really is essential to medicine, agriculture, aquaculture, commercial food, and bottled water production in the United States. So unfortunately, waterborne pathogens can thrive in something called biofilms, which may be a problem in both dental and medical devices. It can also be something that grows in piping and air conditioning systems and cooling towers. We're going to talk a lot about Legionella, and I'm particularly concerned about this issue as a healthcare provider. The second type of special use of contamination is agricultural wastewater, which can be contaminated with both microbial and chemical contaminants. And this is also a concern to me since I am from a family of farmers and ranchers, and I appreciate the challenge of this special uses of water as well. I want to spend a few minutes discussing recent trends in Legionella colonization of biofilms in medical devices and in hospital settings. I was quite surprised to see these new numbers that came from the CDC in September as well. Growth in catheters and dialysis machines or on piping and air conditioning systems and cooling towers really may be a serious threat to your patients if they're colonized with Legionella. So let's review a few of the sobering data from the CDC. Since the reporting requirements in 2001 included Legionella, Legionella has become the single most commonly reported pathogen associated with drinking water outbreaks in the United States. And during this most recent reporting period, 2005-2006 surveillance period, 100% of the waterborne disease outbreaks associated with Legionella occurred as a result of Legionella colonization of plumbing and pipes, and 80% of them occurred in a healthcare setting. In addition, 63% of waterborne disease outbreaks associated with water that wasn't intended for drinking was caused by Legionella. 3 of these outbreaks were in healthcare settings, and all of the healthcare-related outbreaks were attributed to contaminated cooling towers. So the term healthcare-associated Legionella from waterborne exposure to Legionella is really becoming a challenging issue. I have to tell you that there have been 3 outbreaks of waterborne Legionella disease in 3 separate medical centers and senior living facilities within 60 miles of my office in the last 4 months alone. And again, the consequences of waterborne disease in immunocompromised patients can be deadly, as it was for this patient who died after becoming infected from a contaminated cooling tower while being hospitalized in a facility just north of my office. Here's another sobering example. This occurred just in October, the healthcare-associated Legionella. This was in a New Jersey facility. At least 3 patients had died after contracting Legionella disease. They were all, apparently 8 illnesses. All of them were staying on the same oncology wing, again, the susceptible population risk factor. And the hospital officials were tracing it back to a decrease in chlorine levels in the hospital's water system. Again, major challenge for hospitals, particularly that are older facilities, but this is going to be an emerging and ongoing challenge for us as healthcare providers. Let's review a few examples of the special uses of agricultural water, which may become contaminated with microbial contaminants, including infectious zoonotic pathogens. I'm sure most of you remember the spinach recall in fall of 2006. So this E. coli outbreak may have resulted from contaminated farm water used to water the crops. It was a very long epidemiologic investigation. This report, which the public saw many times, suggests that spinach consumers continue reporting their E. coli illnesses to government investigators, and they had expanded their reviews far beyond just the one series of fields, but to a large area of the Salinas Valley. Again, at this point, government and other experts thought that water on the farms could have been the culprit, but these investigations are very, very difficult, and it's very difficult to prove what the exact cause may have been. Following that, you'll remember it was a 1-2 punch. Remember right after that outbreak, California lettuce was recalled again over E. coli concerns, and producers were taking measures at that point, again thinking about possible water contamination. So that was less than a week after the FDA had lifted the warning on the fresh spinach in the California Salinas Valley. So these are major issues that we need to continue to address in the United States. This slide indicates that really the problem of contaminated water in industrialized farming is going to be an ongoing challenge for us, given the way we produce food in the United States. This report highlights concentrated produce industry, highlighting the risk again of the E. coli bacteria may be from live cattle. It could be spread from manure and rainwater runoff, as we described happened in Walkerton, Ontario, irrigation lines, packaging plants, or even through infected workers. And the problem here is it's really very difficult to decontaminate fresh fruit and vegetables. And in some cases, the E. coli has become very, very clever. If it's part of the growing process, it may not even be something that a consumer can easily wash off. It may be very, very difficult to decontaminate this produce once it's been exposed to special use of water. Another aspect of special use of water contamination is the use of water. Again, we need it for agriculture, medicine, aquaculture, a whole host of things. And in animal hormones and pharmaceuticals, which are used in livestock production routinely, these compounds may retain their biological activity when ingested by humans exposed to the agricultural wastewater. Also, ingestion of fish and seafood found in water contaminated with high concentrations, let's say, of enteric bacteria, parasites, viruses, marine toxins can be a huge issue, and chemical contamination such as mercury can also cause adverse effects, particularly, again, in susceptible populations. So here's a journal article that occurred, that was published in 2005 in Environmental Health Perspective, discussing the issue of pharmaceuticals in water, retaining their biological activity when ingested by humans exposed to agricultural wastewater, and in this particular case, talking about a possible link to endocrine disruptors. The report is entitled "Damming the Flow of Drugs into Drinking Water." Now, this abstract reads that over the past several years, roughly 100 pharmaceuticals have been found in waterways in both Europe and the United States. And their concern was that this finding may raise a question of what the effects of such pollution would be on not only the ecosystem but on human health. So an emerging issue at that point. And then, of course, let's fast forward to September of 2008. Lots of interest in the press, a lot of concern among the public about the following report that the Associated Press released. 46 million in the U.S. have drugs in drinking water. Testing shows traces of meds in water greater than previously reported. Now, this nationwide testing was prompted by an earlier AP story that revealed trace amounts of pharmaceuticals in drinking water supplies. It also prompted federal and local legislative hearings. It brought about calls of mandatory testing and disclosure, and led officials in several metropolitan areas to analyze their drinking water. This slide depicts the results from that initial testing across the U.S. The red circles indicate the presence of pharmaceuticals in drinking waters in those areas. And I believe a quote from one of the water utility spokesmen from one of these cities, I think, sums up the situation very well. He said, "This is obviously an emerging issue, and after the AP stories came out, we felt it was a responsible thing for us to do as a utility to find out where we stand. We believe at these levels, based on current science, that the water is completely safe for our customers. But we don't want to create any unnecessary alarm, but at the same time, we have a responsibility as a municipal utility to communicate with our customers and let them know." This issue continues to gain interest. It's captured the public's attention. Your patients may ask you about this. An array of pharmaceuticals have been detected in drinking water supplies and include everything from antibiotics to anticonvulsants, mood stabilizers, estrogen byproducts. Now, the concentrations of these pharmaceuticals are really very small, and we're talking about measurements in quantities of parts per billion or trillion with a T. This is far below the level needed for a therapeutic dose. And most of the water utility folks that I've spoken to are really quite confident that their water is safe. But the EPA is taking several actions to strengthen its understanding of the risks posed to human and environmental health from pharmaceuticals and water. They have just commissioned the National Academy of Sciences to provide scientific advice on the potential risk to human health from low levels of pharmaceutical residue in drinking water. The EPA is also participating in an international effort with the World Health Organization to study appropriate risk assessment methods for pharmaceuticals as environmental contaminants. So there is significant future activity planned on this issue. Another critical source of water contamination and potential waterborne disease results from man-made disasters and possibly intentional water contamination or water terrorism. Man-made accidents such as chemical or radiologic releases in source water or in recreational water for that matter can lead to serious public health challenges and waterborne disease in our patients. And again, as I mentioned before, water may represent a potential target for terrorist activity with intentional contamination of U.S. water supplies as part of an organized effort to, again, disrupt and damage important elements of our national infrastructure. Now, here's an example of a man-made accident. This is a shot on the slide of the oil spill that occurred in the Mississippi River this past July. Certainly is an excellent example of a man-made disaster. A chemical tanker split a fuel barge in half in the Mississippi River. In this case, spilling fuel oil and forcing the closure of a 58-mile stretch from New Orleans southward. And as you can see from this slide, the dense oil slick is going to be a challenge for cleanup. There were 400,000 gallons of spilled oil in this one event. Obviously, there were probably resultant issues regarding contaminated source water along this stretch of the Mississippi, as well as environmental contamination of recreational waters along this 58-mile stretch. And finally, the fifth critical source for you to remember for potential water contamination and water disease is natural disasters resulting in water contamination. And I've already reviewed with you several examples from Katrina about the impact of natural disasters, which obviously can result in serious water contamination and subsequent disease in affected residents. Now, I'd like to review with you some recent trends in waterborne disease and water-related deaths that result from drinking water and recreational water exposure in the United States. I really believe that this is extremely valuable for clinicians to have really a working knowledge of these trends, as it allows you to target your evaluation of patients based upon their risk of developing water-related disease. This understanding, I believe, leads to improved exposure histories, improved evaluation and management of patients who may be experiencing waterborne exposure to water contaminants. So the next series of slides is information that I've abstracted from the CDC surveillance data that they released on September 12th in this fall. So first, let's review the disease trends for drinking water exposure. These slides include the drinking water exposure at the top of the slide. I'm going to follow this with some of the disease trends for exposure to waterborne contaminants in recreational water. And I think that you'll find some of this information surprising, and it may change your approach to evaluation and management of your patients. This first slide addresses waterborne outbreaks from drinking water by water source. So during the most recent reporting period of 2005 and 2006, the CDC reported that 87.5% of waterborne disease outbreaks in drinking water resulted from groundwater contamination, as opposed to 12.5% from surface water contamination. Now, it's an extremely important question for you to ask your patients. What is your drinking water source, and do you use a private well in the thought that they may be impacted by groundwater contamination? So this is an important question for you to ask every patient. This slide addresses waterborne outbreaks from drinking water by year and illness. And I'd like you to look at the trends here, and I think you can see on the right-hand portion of the slide. The first important trend to note is the decreasing number of waterborne disease outbreaks in drinking water that have occurred in the United States since 1971. You can see that the slope to the right of the slide is going down, it's decreasing. I'd like you to remember this trend, and we're going to compare this to the number of recreational water outbreaks later in the presentation. So the important point for your clinical evaluation from this data is remember to consider other exposure pathways other than drinking water when evaluating a patient for waterborne disease. This is a slide that addresses waterborne disease outbreaks in drinking water by etiologic agents. And I think my point about the increasing presence of Legionella as a waterborne pathogen is clear. 50% of the reported drinking water outbreaks resulted from Legionella in the most recent reporting period from the CDC. And I've been emphasizing the increasing problem of Legionella as a potentially deadly waterborne pathogen, especially in susceptible populations throughout this presentation. So the important point for your clinical evaluations from this slide is again to remember the emerging issue of Legionella in your evaluations, particularly for your patients who are hospitalized, who've been recently hospitalized, those living in senior centers, or anyone who's a member of a susceptible population. Let's quickly review waterborne outbreaks in drinking water by deficiency. This is a very interesting trend. 43.5% of drinking water outbreaks resulted from deficiencies in source water, treatment facility, or distribution systems deficiencies, while more than 50% resulted from deficiencies that were outside of the jurisdiction of a water utility or a point of use deficiency. Again, this trend may speak to the important issue of waterborne pathogens such as Legionella that can colonize in biofilms and distribution pipes, let's say in hospitals or in medical equipment. This is outside of the responsibility of a water utility. Again, important points for your clinical evaluation of patients from this data. Remember the recent CDC surveillance information. 100% of waterborne disease outbreaks associated with Legionella in the most recent reporting period occurred as a result of Legionella colonization of plumbing and pipes, and 80% of them occurred in a healthcare setting. Let's turn our attention now to waterborne disease outbreaks from recreational water exposure. This first slide again addresses the outbreaks by year and illness. The first important trend to note is the increasing number of waterborne disease outbreaks resulting from recreational water exposure that have occurred in the U.S. since 1971. Remember the downward slope of the number of waterborne disease outbreaks for drinking water out in the previous slide? It's the opposite trend here. Important point again for clinical evaluation of your patients. Remember to consider other pathways other than drinking water when evaluating a patient for waterborne disease. The most recent 2005-2006 reporting period, remember, 78 recreational water outbreaks with 4,000 illnesses and 5 deaths. Again, a large number of recreational water outbreaks, continuing trend upward in the United States. Next slide addresses waterborne outbreaks from recreational water exposure by water type. Again, I would like you to turn your attention to the right-hand portion of the slide. The dark blue graph indicates treated water, and the lighter blue bar indicates fresh water. So when you compare the trends, treated water venues include outbreaks that arise from exposure to waterborne contaminants in swimming pools, wading pools, water parks, decorative fountains, and hot tubs. Untreated or freshwater recreational exposure would include exposure from lakes, ponds, rivers, canals, beaches, oceans that may be contaminated with microbial or chemical contaminants. And it's really important to note the spike in outbreaks in treated water venues is illustrated in this slide. In your clinical evaluations, remember that long list of recreational water outbreaks that I reviewed with you that resulted in waterborne disease from treated water venues, and especially remember these during pediatric evaluations. This slide addresses waterborne disease outbreaks from recreational water again by etiologic agent. Clearly, parasites top the list and can be a real challenge for us in the evaluation and management of patients who may have been exposed to recreational water, whether it's from treated or untreated water. So recreational water exposure, again, can be potentially deadly for patients, whether it's the parasite, bacteria, or waterborne viruses during their exposure. With my remaining a few minutes, I'm going to address what I believe to be the importance of medical practitioners as sources of information and education regarding water quality and protection for not only their patients but also their communities. It's a time of very severe economic concerns, and I believe the importance of protecting our water resources and maintaining critical water infrastructure is really imperative. So I'd like to very briefly review some of the costs or estimated monetary burden of just infectious waterborne disease outbreaks that was developed by the EPA in 2006. As you can see from this slide, the monetary burden over a 30-year period of time for just infectious disease outbreaks in drinking water, and that doesn't include all the other types of disease burden that we discussed, is estimated to cost our society more than $610 billion from actual costs of medical treatment and in particularly all the lost productivity. This next slide attempts to break this cost or this burden up based upon geologic agents. And again here, with $480 billion attributed to the cost of protozoan pathogen outbreaks, probably mostly susceptible. And this last slide attributes the monetary burden to society from deficiencies by water system type. The burden from water treatment facility deficiencies at $505 billion, followed by distribution system deficiency and untreated groundwater, topping the list in cost burden. Now, I think that these cost estimates really reinforce the fact that the cost of, quote-unquote, doing nothing to address water protection issues and water infrastructure maintenance problems and funding in the United States is a very real and potentially very serious burden to our economy and society. How do we tackle all of these important issues as clinicians? I really believe that any effective approach to protecting water quality and the public health depends upon cooperation among a multidisciplinary team of professionals that should definitely include the medical community. The medical and public health community is really going to need to foster new partnerships with water utility practitioners and community leaders to protect really their patients' health, the public health, and ensure water safety and quality in the United States in the future. Now, this team approach also applies when we attempt to mount an effective response to a particular water contamination event that may occur in your community. The challenge here is that this effort generally requires cooperation from diverse disciplines that physicians are traditionally not used to working. I also want to make the point that medical and public health practitioners are really positioned to provide credible and very timely risk communication and public education to their patients and their communities regarding the public health challenge of protecting our nation's water reserves. Several surveys have indicated that healthcare providers are among the most trusted sources of information for the general public regarding drinking water quality and safety in the United States. And you certainly can expect, and I'm sure have experienced, many community residents are immediately going to turn to their healthcare providers for advice regarding the safety of their drinking or recreational water following any type of contamination event or waterborne disease outbreak. I also believe that healthcare providers are positioned to play a leadership role in educating their community about the importance of protecting watersheds, groundwater, and oceans from biological, chemical, and radiologic pollution, really to lead to preservation of our water resources, with the outcome being protecting our community health. My last goal today, as I wrap things up, is to really give you a brief overview and provide you with some ready-made resources, some take-home tools to assist you with the task of recognizing, managing, and preventing waterborne disease and the health effects of water pollution. The website that Dr. McClellan referred you to, Recognizing Waterborne Disease and the Health Effects of Water Pollution, is a physician online reference guide, and it is available at waterhealthconnection.org. This was created to assist the medical and public health community to do what we just discussed today, better recognize and manage waterborne disease and the health effects of water contamination, whether the contamination came from natural, man-made, or intentional contamination of water. And as mentioned to you, the response to this resource has really been gratifying. We've had a very broad user base, far beyond the intended audience of physicians in the United States. In the past 4 years, we've had almost 10 million hits for information and 350,000 users from 89 countries across the world. Now, the website is available to you 24/7. It's free. It's very content-dense. It was the targeted audience was healthcare providers. It is not a consumer site. It's intended to provide clinically relevant information that addresses water-related disease, a special emphasis, again, on patient risk evaluation guidelines for both healthy and susceptible populations regarding water-related disease. I would like to encourage you to visit the water website. It's, again, a free reference guide and was really intended to be very user-friendly for healthcare providers and a ready-made tool to assist you. I don't have time to go over all of the sections of the website, but I have attached several reference slides from the water website to this PowerPoint presentation that follows after the question and answer slide for your review and reference. With that last comment, I believe we're ready to address your questions today and open up a dialogue about our subject. Dr. McClellan is going to assist me with this portion of our presentation. Dr. McClellan is a waterborne disease expert in his own right, so I'm hoping that between the two of us we're able to answer your questions and open up a dialogue today. Dr. McClellan?
Well, thank you, Pat, for that wonderful overview of an extraordinarily important pillar of public health, as you point out. Let's start with 3 questions that are part of the MOC credits, and I will address these to you and appreciate your response. So question number 1 is, which statement regarding the need for healthcare provider training in the recognition and management of water-related disease is correct of the following 4 choices?
I think I made this point throughout the presentation, and I'm sure everyone will be able to answer. The correct answer is B. It is a diagnostic challenge no matter how skilled you are at evaluating water-related disease. It's a difficult diagnosis to make, which really requires healthcare providers to be very conscientious and be thinking outside of the box and really emphasizing those important questions in the exposure history in order to develop the diagnosis hopefully early, particularly in those susceptible populations who may very, very quickly develop very severe disease and death from waterborne exposure.
Thank you. Question 2 is that local community physicians may provide the first warning to health authorities of the possibility of waterborne disease outbreaks in their communities. True or false?
Obviously true, and I think there were many examples in our presentation, and that I really believe the local community physicians with appropriate training can be the frontline responders to many of these water contamination events, and of course several of them have already proven that and can be a very, very valuable resource for both water utility professionals as well as obviously the public health authorities in their communities. So I'm a strong believer in outreach and training to local community physicians since they are the ones that are on the front line of seeing the initial indications of a water event in their community.
Great, thanks. And the third question is, healthcare providers should embrace their role as active participants in the public health challenge of protecting our nation's water supplies. This responsibility is particularly important based upon which of the following facts?
I think it would surprise many healthcare providers to know that when surveys are taken that healthcare providers are frequently, if not the top choice, within the first 5 of trusted resources regarding water quality and waterborne disease issues. And I think this is surprising to many healthcare providers because many of us have very little training in it, although the public believes and our patients believe that we're a valuable resource and a trusted resource. So the answer is A. Whether we're prepared or not, the public believes that we are a trusted resource for information about drinking water quality and drinking water safety, which is why I think it's so important for all of us to have at least a basic understanding so that we can provide credible and useful patient information and patient and public education about the importance of water protection and the consequences of not protecting our water, which is some of these serious public health challenges that we addressed during the first hour of our webinar.
Great. Well, thanks. We've gotten a number of questions from our audience, and so I'll start presenting them. And I encourage anyone out there who hasn't yet had a chance to pose a question, please take advantage of the Q&A feature that you see at the top of your menu bar to ask that question. We'll try to get to as many of these as we can. The first thing I'd like you to comment on, Dr. Meinhardt, is that there certainly have been a substantial change, and I think one could agree strengthening of regulation of drinking water over the past 20 to 30 years. Did you want to make some comment about those changes in regulation, whether it be municipal water, bottled water, some of the things that may be going on at the private well water. What's happened briefly in the past 30 years in our country that may indeed have strengthened our protection of the people who either drink water, and then you might want to also comment on what's going on in the recreational water world.
Well, I think we had a sense of it from looking at the data from the CDC. I think it's quite dramatic, and I think when I train physicians, they're really quite shocked. I think the reflex for most healthcare providers is if there's an issue of waterborne disease in their patient, why it clearly must be the drinking water. And if you look at the data and you look at the history of the regulations in the United States over the past 30 years, I think it's extremely reinforcing that those trends have gone down, and that it's a complicated process, as we all know. Regulation at this level takes many, many years, and it's a very, very difficult process. But we have indeed made some progress, and I think that the trends from the CDC indicate that. What we weren't able to discuss is the source of water, whether it be public or private, the whole issue of folks who have their own private wells. That is, I think, a huge issue, at least for me. I really try and emphasize with healthcare providers, since I grew up in an agricultural environment where we had no running water, we had a well and a cistern. I really understand the problem of private wells for the many rural residents in the United States, and the fact that they may not have the funds or be as conscientious about thinking about water quality based upon the fact that they're in charge of trying to maintain the quality of their water. I think that what I would like to say is that I'm hoping that there is going to be much more of an emphasis on reaching out and assisting folks who do have their own private well and work in that direction as well. Recreational water exposure is, I think, really an issue that we need to turn a serious amount of attention to. As many of you know probably better than I, it's difficult to regulate some of these venues that we're talking about. Very, very difficult, basically done by state. So it's a difficult sort of issue to wrap our hands around, but I really believe that given the number of incidents that have occurred, that that's an area where we need to be focusing a lot of attention in the future. So I'm thinking also that one other issue that I really want to talk about and make a point of is we've improved a lot of our regulation around drinking water issues and public drinking water, but what's facing us is a massive, massive problem of how we fund drinking our water infrastructure, particularly in the Northeast, where many, many of our water infrastructures are 100 years old, if not older. The water main breaks that we see in Boston and New York. So, again, even though we've got a serious economic, tsunami facing us, I really also believe that as far as a focus on public infrastructure support and funding, I am clearly a champion for making certain that our water systems are included in that, because regulation is important, but if our distribution systems and the way we get water to the end user is not addressed, it's going to be less effective for following all the regulations at the water treatment plant based upon what happens once the water leaves the plant, and the fact that we really have a serious need to be working on those distribution systems and funding them and supporting them in each of our local communities.
There's several questions regarding pharmaceuticals and low-level contaminants. Obviously, we now have the technical capabilities of measuring parts per billion, parts per trillion. First of all, what are some of the most common pharmaceuticals or other low-level contaminants that have risen to the top of concern? And what are your thoughts and comments as far as the regulatory community or perhaps even the epidemiologic community, as far as where should we be investing our resources?
You know, this is an issue that has, as I'm sure all of the folks on the call today understand, it's very difficult to do, you know, a good job of determining from an epidemiologic point of view where we stand with this. A couple of I think, large issues loom here. As far as the pharmaceuticals that are discovered depending upon each one of the metropolitan areas that participated in this initial screening, the range of pharmaceuticals was actually quite different depending upon the city and region, which is a surprise. So in certain areas, you know, the main issue was, you know, various drugs that one wouldn't suspect. Estrogen byproducts from various uses of estrogen replacement therapy in many communities was highest on the list. In others, it was acetaminophen. It was really a very, very broad range, very difficult to try. There were no, from what I have seen from the initial data, and there may be others who have more information, there weren't really very specific, clear trends. There wasn't one drug that rose to the top across the U.S. And again, the numbers, the parts per billion and parts per trillion that were found in drinking water are extremely low. I think what many people are concerned about from an epidemiologic and medical point of view is, what is the impact of multiple exposures to low levels of multiple drugs? And again, that's a very, very difficult issue to try and address from an epidemiologic point of view.
Mm-hmm. Great, thanks. Now maybe on to a very practical question, and that is, what should the recommendations be to perhaps immunosuppressed patients or consumers of tap water be? And maybe with that, why don't you address the whole issue of point of use technologies for either in the municipal setting or a water setting or in the private well setting?
This is a subject that I know Dr. McClellan knows better than I, but I will give you my impressions of this. Point of use filters for immunosuppressed patients, I believe, can be a useful addition to prevention behaviors for immunosuppressed patients. The caveat is you need to select the point of use filter well and make certain that it has the factors that will remove the particular pathogens and chemicals that would be most that you are most at risk for, and then they need to be maintained. As we all know, point-of-use filters can actually create a problem if there's overgrowth in the filter if they're not exquisitely maintained. So the caveat is they can be useful, but they really require conscientious maintenance and care, and there's something that you need to be concerned about. On the private well side, again, I think that they can be useful, but again, I worry about maintenance, and I've certainly had patients present who ended up with actually more problems than they solved by not maintaining those systems and being absolutely conscientious about their care. So I'm a believer that they can be useful in selected settings as long as people understand that they do require maintenance and follow-up.
Great, thanks. I certainly would agree with you, and I think it has to start with an understanding of what the source of your water is. And when you turn on the tap, that water may be coming from a municipal water supply that is testing, more than once a day, and then, or it may be coming from your private well. And so the point of use solution is going to be quite a bit different if you're going to employ one. And very much based on the exact contaminants of the water that you're concerned about. There's another question about biofilms. The questioner just wonders what the heck are they, and what impact might they have on water quality?
Well, that's an excellent question, and biofilms are a mystery. Biofilms are extraordinary colonies, basically communities of pathogens, and they are really quite challenging for us. Biofilms can live in the interior of distribution pipes, and from sediment and a whole host of other things, actually develop similar to a plaque in your arteries, develop a foothold on those pipes, and have a very, very comfortable little environment and develop a colony of pathogens, in which in particularly Legionella seems to thrive upon. There are other pathogens that are also very comfortable in biofilm settings. And the reason this is such a huge problem is again, the water treatment facility may be providing your home or particularly a hospital with absolutely appropriate water, but if biofilms are living in the distribution system of the hospital and those pathogens are able to take hold, that's what I think we're seeing with a lot of these Legionella outbreaks. It's really, again, it's outside of the jurisdiction of the water treatment facility, and some of those environments, whether it be increased temperature, whether it be in our water heating systems, cooling towers, in our medical devices such as respiratory therapy equipment. It's a very challenging problem, but we really need to address it. And there are many directives and initiatives that have come out. The Veterans Association in the United States has a whole new initiative for addressing Legionella, particularly in their oncology units and all of the units throughout the United States that provide care to veterans who might be in immunocompromised settings or immunocompromised populations. And I believe that it's a fantastic initiative and one that I hope many other hospitals will consider, because we really need to be thinking about prevention and trying to determine as soon as possible if there's an issue and work with whatever we can, the water utilities, or work within our hospital settings to try and keep those levels low and that exposure low. And it's a problem that's not going to go away. And it's unfortunate because it's a huge problem, again, in a lot of older facilities, older pipes. Some, again, are going to be 100-plus years old. So it's a big challenge, but I'm quite worried about it as a healthcare practitioner. I believe that those increased levels of Legionella outbreaks are potentially a new emerging issue that we have to be concerned about as healthcare providers.
Thanks. You've mentioned some fairly potent examples of outbreaks, and I wonder if you have any thoughts about strategies that might be more effective at coordinating information exchange between all the stakeholders who really should know, need to know in order to prevent an outbreak. And so the Seal Beach example is one that you brought up where, unfortunately, someone knew something, but that was not communicated to other people who needed that information to protect themselves.
It's a big challenge, and it's something that I know both Dr. McClellan and I are very committed to, but it's that whole concept that we can't have silo mentality in our communities when it comes to water, because water is so pervasive and touches our lives in so many different ways. I really believe that that in each community, whether you're a physician or a water utility manager or public health professional, that it's important to reach out to those other stakeholders and try and develop a dialogue early on, whether it's having lunch once every 6 months or trying to develop perhaps, being part of an emergency response team, just trying to include water as one of the very important issues that everybody in a community needs to be familiar with early on. I think that, again, these are potentially folks that physicians are used to, not particularly comfortable or used to sitting down with, but having a working relationship with the head of the water utility, the public health department, the emergency room director, so that everyone's on a first-name basis, and when there are even suspected issues or cases, long before it's a confirmed outbreak, if we can talk to each other and get some feedback and work together as a group, I think that it would have a huge impact on nipping these outbreaks in the bud early on and develop a more cohesive approach to protection of many of these water resources as well.
Great, thanks. Another very practical question from one of our listeners is, if a patient suspects contamination of their private well water source, what's the best way to go about getting their water tested?
This is a really important question, and I always get pushback from a lot of private well owners who are very worried that if they take their water in for testing, that, quote unquote, the state will shut my water down, will shut my well down. There is, I believe, a lot of paranoia, particularly for rural residents, where I grew up in eastern Montana, where people are concerned that the test results will then force them to have to drill a new well, or that someone will cap their private well. I think that the best thing for most people to do, and particularly since a lot of these resources are available online, if they want to remain anonymous, is to reach out, obviously, to their local health department, either online or via telephone, and see what resources are available. Many, many communities have set aside funds and resources to assist people either with appropriate testing or assisting them with filtration systems, and even helping them determine what kind of point of use filter they might need, or an adjunct system for them. So I really encourage people, again, to reach out to their local health department and determine what resources are available to them, and get on it early before their children or their pregnant spouse may be affected by something that could have been easily prevented and filtered out of their private well water.
And I'll point out, just to reinforce what you said, several states actually have funds that are available to help defray the cost, or in fact pay for the entire cost of a treatment system, depending upon the source of the contamination. Another question, just to move back to intentional contamination. There's a question about if indeed there were to be intentional biological contamination, is there a most likely scenario as to how this might occur? Where would which part of the system might be targeted? Is there particular organisms likely to be of more concern?
Well, yes to all of those. I'm not certain that we want to sort of discuss those on the call today, but I would recommend that people go to the Water Health Connection website, because we have an entire section on intentional contamination of water. And there are, yes, many vulnerabilities in our system as it is currently configured that are potential targets. The one thing I do want to say is that we've made a lot of progress, particularly the water utilities folks have made a lot of progress in securing treatment plants and doing everything they can to secure the system since 9/11. So we've made a lot of progress, and you may see that in your community. It used to be that you could take school children through a tour of a water facility, and those sorts of things are no longer as frequent or possible, because we're thinking much more about the security of our water system. But there are a whole host of ways and vulnerability points in our system, and I have those all basically sort of summarized in a sense to give people a heads up, and physicians a heads up about what they should be looking for. The same sort of thing if they see waterborne disease after someone has been to a community event, to possibly be thinking about intentional contamination. There are a variety of syndromic surveillance clues that will help us determine if there's been an intentional contamination event. So I have a pretty significant discussion of this whole issue on the website, and I'd like to refer people there. It's a great question and something that we all need to be conscious and aware of, but also to understand that a lot of progress has been made in the last bit of time to enhance security of our water and our water distribution system.
Great, thanks. Next question, turning back to recreational waters, and I think this is going to need to be our last question. Given the reported increase in illness, do you have some sense of whether this trend is due to an actual increase of illness, or is it really an issue of a reporting bias?
Well, clearly, I think it's probably both. But I do think that particularly water parks have become so popular and so much a part of what Americans do now on vacation. And I do think that there needs to be much more conscientious thought about, let's say, having all children in diapers, in swim diapers. Be thinking consciously about the fact that, you know, an accidental fecal event in a large, you know, wading pool will potentially impact your child as well as potentially 120 other babies that are there. So I do think it's probably increased reporting bias, but it's also that we have become, you know, a population that spends an awful lot of time in these water venues, and they're perfect mechanisms, they're perfect venues for a lot of people to be exposed in a very short period of time.
Great. Well, my clock says that we're right at the bottom of the hour, so I thank you very much, Dr. Meinhardt, for that superb, very comprehensive overview of issues related to waterborne disease and control of those problems. And thank you for being so responsive to these questions. Thank you all, audience, and look forward to seeing you perhaps at the next ACOEM webinar, a whole different tact on Americans with Disability Act amendments, some very new things coming down the pike. So thank you all, and goodbye.
Thank you very much, ladies and gentlemen. This concludes today's webinar. Thank you for participating. You may all disconnect.